Good afternoon and welcome to today's town hall sponsored by Hearing Loop Canada. My name is MISHKA BALSOM and I'm the CEO of the Greater Niagara Chamber of Commerce. Our theme is building inclusive spaces by removing barriers. And one such barrier can be our hearing. It is one of our most important senses, which enables us to connect to the world for many very important and often vital reasons. Hearing loss is a growing invisible condition that impacts over 4 million Canadians, and that number continues to increase and affect more generations than ever, including children. So today's dialogue will focus on how we can improve the hearing experience for those affected by loss, both from a community and a corporate responsibility perspective. Leading us in this conversation will be Ruth Unrau, an accomplished public speaker and leadership coach, event MC, and radio host, working with entrepreneurs, emerging leaders, and community organizations. She has assisted over 1,000 new and emerging businesses through planning and startup phases. Ruth has worked with several high-profile Niagara-based events as an MC and interviewer, and also hosts a weekly show called Niagara Made on 610 CKTB Talk Radio, where she interviews local entrepreneurs and business owners about their challenges and their successes. Ruth is the co-founder and a member of Women in Niagara, and also volunteers for many Niagara-based organizations, including as the director for the Passdown Foundation Board and vice chair of the Niagara Region's Women's Advisory Committee. Ruth, it's a pleasure to have you with us today. Over to you.
Thank you so much, MISHKA. And I'd like to welcome everyone to our chat today about removing barriers and building inclusive spaces for the deaf and hard of hearing community. But before we get started, I'd like to introduce you to the managing partner of Hearing Loops Canada, the sponsor of today's event. Please welcome Mark Gagnon.
Thank you, Ruth. Good afternoon to everybody, and just wanted to say a couple quick thank yous as the proud sponsor of this event. And on behalf of Hearing Loops Canada, wanted to thank MISHKA and her amazing team at the GNCC for hosting such a great event. Also the amazing panelists that we will hear from shortly, and all of you for attending, taking the time to learn a little bit more about accessibility. And a special thank you to our celebrity moderator today, Ruth Unrau. Thank you so much, Ruth. Great to work with you. Before I hand it back over to Ruth, I just wanted to take a quick 30 seconds to a minute to tell you a little bit about Hearing Loops Canada, who we are and what we do. I guess as a sponsor, I have the privilege to do that. Yeah, Hearing Loops Canada was established in 2017 in the province of Alberta. And we really set out with a vision to be the #1 authority for hearing assistive technologies that help remove communication barriers, help build inclusive spaces, and enhance the quality of life for people with hearing loss. When we looked at our Canadian expansion to accelerate our Canadian expansion, I'm a longtime resident who grew up here in Niagara. We actually chose Niagara for our Eastern headquarters with a team of design technicians and service technicians based in Niagara-on-the-Lake that could service all of Ontario. It just made sense. So I'm very, very proud to be able to build something here in Niagara, or continue to build something here in Niagara, and the support from the community, both private sector, public sector, small and large national business has been amazing. So thank you very much for attending today. I'm going to hand it back over to you, Ruth, to get the show off. Thank you.
Thanks so much, Mark. I'm not quite sure about that celebrity status, but I'll take it. Thank you so much. So as Mark was saying, today we're talking about removing barriers and building more inclusive spaces for the hard of hearing and deaf community. We're going to talk about the progress we've made, the opportunities that exist, and what else do we need to do. We're joined by 3 panelists today. Lee, Noelle, and Steve, each who bring a unique perspective to this discussion. I'll be introducing each of them as we go along. And I just want to mention that You had an opportunity to submit questions prior or when you registered for the event. So time permitting, we'll be looking at those, as well as if you have a question that comes up during our panel discussion, put it in the chat. We'll be monitoring that. And as I say, we're going to get to everything we can. For questions that we might not be able to get to, there will be a follow-up email sent to each of the attendees today. So you don't have to worry about not having your question answered. And we're also going to have access to Steve, Noelle, and Lee. So should we need their expertise in terms of answering your questions, we'll be able to do that too. So please feel free to ask questions. And as I say, we may get to them today, or you may get a follow-up email. So without further ado, I'm going to start by introducing Lee Pigeau. Lee Pigeau is the Executive Director of Canadian Hard of Hearing Association. He has vast philanthropic experience and an entrepreneurial background through his consulting firm, working with small grassroots organizations and large multinational charities serving people with disabilities. He is one of the Resilience 2020 project leads, a collaborative effort to assist charities during the COVID-19 pandemic. As the new National Executive Director for the Canadian Hard of Hearing Association, Lee looks forward to being a part of the transformation that will bring the association to the next level and make a positive difference for Canadians living with hearing loss. Welcome, Lee. Lee, according to the CHHA website, there are 4 million Canadians that are living with hearing loss. There have been some impactful changes in this space that we can see now, such as closed captioning, which is happening today for the panel discussion, sign language interpreters, as well as all kinds of new technology, including what Hearing Loops Canada does, which is the, now I can't think of the term, but we're probably going to get to that. So as the conversation around equity, diversity, and inclusivity becomes more amplified, when it comes to the deaf or hard of hearing community, what progress have we made, and where are the opportunities to do better, especially from a business or employer perspective?
That's a really good question, Ruth. When we talk about invisible disabilities and inclusivity, a lot of times it's those disabilities that you can't immediately see or know or understand that are the hardest to deal with. But hard of hearing people have been used to that for a long time. And there's a big difference between someone who can't hear at all or has profound hearing loss and someone who just may need a hearing aid, has a cochlear implant, which allows sound to travel through bone rather than through the eardrums, in a workplace or in a customer service setting. So for example, there is about a quarter of the population that has some sort of hearing loss. And we can generally think about that in the same way as someone with glasses. They need a little bit of different help, a little bit of accommodation, but there's nothing that really stops them from doing anything, profoundly. As office workers, a lot of us do a lot of our work by text or email or on virtual conferencing. And there's been a lot of strides in that really helps people with hearing loss. There's closed captioning, there's ASL interpreters, and of course, the written language. People are really good about that. But it's the day-to-day activities that really make people feel excluded. Whether you're trying to talk to a customer service representative and they keep asking, and you have to ask for clarification again and again, and they talk louder in a store, and they start to get frustrated, and it makes you feel embarrassed because you're drawing attention to yourself, and sometimes the questions are quite simple. That type of exclusivity. So people just don't ask. They don't become a part of society. People who have a hard of hearing, especially that it affects their day-to-day life, over half of the people who have a hearing disability say that it affects them in a negative way in social interaction. And when people miss out, that's when they get excluded. And from a diversity perspective, if someone who has a hearing loss or is talking to someone with a hearing loss and they have a different way of speaking, they may not know the language as well, that makes them feel less a part of society. And in settings where there's a lot of noise, in agricultural settings, in customer service settings, big stores, any type of shop, we really need to do something individually. And I think that that's what's most important, whether it's just simply being able to write something down, being able to show somebody something in writing is really important. So that's some really simple things. So we've come a long way with that, and there's some really simple things that we can do.
I imagine too, I think, for those of us who live in Niagara and for the businesses that are here, we understand that Niagara has a higher population of older people, right? We're aging. And I would imagine as we age, our hearing loss becomes, we start to experience some level of hearing loss, and that ambient noise that you talked about in various settings becomes even more of an issue. I know there's certain restaurants that I won't go to because there's too much noise. And if I can't hear the conversation that's happening with the person that I'm with or the people that I'm with, then it's not that much of an enjoyable experience for me. So thank you for bringing that perspective to us. I'd like to move on now to our next panelist, Noelle Sinclair. Noelle began to lose her hearing late in high school. Being in radio is not the career you might have expected for Noelle, but that's where she's been for the last 30 years. With the help of headphones and learning to read lips, Noelle was able to compensate for her hearing loss over the years. Less than 10 years ago, with young children in the home and her hearing getting progressively worse, Noelle left the workforce. In 2014, she was the successful recipient of a cochlear implant that allowed her to return to her career in broadcasting. Welcome, Noelle.
Thank you.
Noelle, so you've been through an incredible journey as someone with full hearing to a person that became deaf. And now as a result of a cochlear implant, you are able to hear again. So can you tell us about your journey and about how technology has helped? And also maybe touch on where you see the opportunities and how we can do better, both from being an employee, as you were, as well and as you will continue to be, as well as in our community.
Oh, well, it's been a long journey. I was 18 when I first lost my hearing, and it was a slow progression. But by the time I was working in radio in about the year 2000, so we're going back about 22 years. So I was in my 20s. That was when I had an employer that actually did finally make a comment and said, maybe you should get yourself checked out. And I did. And that's when we started the processes of having my hearing checked regularly. We tried hearing aids. Hearing aids were a really difficult thing for me because I was expecting them to work and they didn't. I have a type of hearing loss called an ototoxic loss. I got strep throat when I was 18, and I was prescribed a drug that was toxic to me. And that's what started all of the hearing loss that I have had over my life. So in 2000, when we started getting hearing aids and attempting them, it didn't do anything. In fact, it actually made it worse because of the things that the hearing aids magnified. They weren't magnifying where I had lost. So my friends were frustrated. My family was frustrated. I was frustrated. My employers were frustrated. We just couldn't seem to get to the bottom of the problem. But, I continued to read lips, adapt. I was very, I was sort of in denial, I guess, in some ways about how significant my loss was because I had tried to compensate for so long, and I compensated in ways where I would bring my daughter with me almost everywhere I went. And she would know from the look on my face, she didn't get that. And she would repeat it slower. And that's how I started coping in society in certain ways, especially in the business I'm in news. When I was working as a reporter, it's very important you get your facts correct. So I was almost able to kind of hide it in a way, because I would say to people I was interviewing, can you repeat that one more time? I want to make sure I got my facts perfectly straight here. And I mean, it worked to my advantage in some ways, but by the time 2006 came around, I could not interview over a telephone any longer. And that's when I made the decision to leave radio. And I took a job working for Big Brothers Big Sisters in Niagara Falls. And they were very accommodating with my hearing issues. They got magnified phones for me. We had a fire drill one day and I didn't hear the fire alarm. We were located at the McBain Center in Niagara Falls, and it's a very loud alarm system. And everybody came to my office and said, "Are we going to lunch? What are you all here for?" And they were like, "You don't hear that?" Next day, strobe light went in, fire alarm accommodated for hearing impaired. So, I mean, I was lucky in that regard that my employer was very adaptable to my hearing loss. But by 2011, my hearing was down to 8%, and I just couldn't function in society anymore. And I went to the doctor. The doctor made me go for another hearing test. And I can get into what that's like a little bit later, but I was very frustrated going for a hearing test. I was afraid someone was going to try and get me hearing aids again. And I didn't want hearing aids. And I was very lucky that the place I went to acknowledged the fact that I was a cochlear implant, possibly a cochlear implant candidate. And that started the ball rolling. And by 2013, I got on the waiting list. And I was expected to be on the waiting list for 15 months. And lucky enough, I got pulled off that waiting list early. And in 2014, I got my life back and I was implanted. And it was life-changing.
There's so many facets of that story,
Oh, I know.
right? Thank you so much for sharing that. And I understand that cochlear implants, there is certain people that it won't work at all for, right?
That's one thing I was really surprised about. It was during the last municipal election, I met a woman and she said, "I understand you have a cochlear implant." And I said, "Yes." She said, "Well, my mother does too. Would you like to come talk to my mother?" And I did. And I was stunned that the daughter was still repeating and helping her mother understand. And the woman was amazed by me because she couldn't understand why I had such a different response to the implant than her mother did. So, I mean, I'm not indicative of everybody. I'm lucky. And Sunnybrook Hospital, where they did my implant, has said to me, I'm an unusual result. I score 80 to 90% on my hearing test now, whereas most people score in the 60s and the low 70s.
Well, it's amazing. And I don't think there's anybody out there that would be able to guess, I suppose, that you're deaf and that you are hard of hearing, because it certainly doesn't look like that at all. So thank you for that. And now, please welcome Steve Murphy. Steve is the accessibility auditor and coordinator for Niagara Region. Steve's current role with Niagara Region has him responsible for legislative compliance for Niagara Region, Niagara Regional Police Services, Niagara Regional Housing, and Niagara Peninsula Conservation Authority. Steve is also the accessibility auditor for the upcoming Canada 2022 Summer Games. Welcome, Steve.
Thank you.
Steve, as you know, the Accessibility for Ontarians with Disabilities Act, or AODA, was adopted in 2005 and establishes a framework designed to make all aspects of public life, including workplaces, fully accessible to persons with disabilities by 2025. As that date looms just 4 short years from now, can you tell us how we're doing and where we can do better from an employer or an organization perspective?
Thank you for the opportunity to be here. Part of my shtick everywhere I go is one of the issues I'm telling people is accessibility is a well-kept secret, and it shouldn't be. It should be on the tips of everyone. Unfortunately, if it hasn't affected you or somebody close to you, we kind of ignore it. And I understand that. As far as where we are with our compliance, the majority of the municipalities and other mandated public organizations like healthcare, school boards and stuff. I would really like to say everyone is putting in the human effort where they can. As you know, there is the customer service standard, information and communication, employment, transportation, and the public spaces. The public spaces used to be called the built environment, but then they took a lot of that and put it in the Ontario Building Code now. So if you're looking for how high a light switch should be, it isn't in the AODA anymore. It's in the Ontario Building Code. Having said that, and talking about the awareness and the need for it, what you were saying a little earlier, Ruth, concerning our aging demographic, I'd like to come back to that for 1 second and just pass on a valuable lesson I had to learn from my father when he was still alive. As much as a lot of our people with disabilities and our people who are aging require the same types of accommodations, don't ever call them each other. And I had learned that. I learned that my father's hearing loss wasn't in his eyes because he was disabled. It was because he was 91 and he fought in a war and he worked in a factory. It was a natural aging process for him. Whereas I speak to members of the region's Accessibility Advisory Committee who have hearing loss or vision loss or whatever it is, and they are more than willing to put me in my place and tell me they're not aging, it's a disability. Having said that, as far as the AODA goes, we have just come to the part in the Information and Communication Standard, which has a lot of us running around somewhat frantically, because I don't think a lot of us understood how complicated it is or how hard it is to find somebody who truly understands what you mean if you say that your websites have to be WCAG 2.0 AA compliant. They just look at you and their eyes glaze over and they usually leave. Having said that, though, we are working on that, we're getting to that. A lot of the municipalities are now using captioning services on the replays of either council minutes or committee minutes. So all that kind of stuff is available. The other point too is just because the AODA gives you a minimal level of compliance, don't be congratulating yourself too much for achieving the minimal level. We can do a lot more. If anyone is interested, there's a lot of publications regarding universal design standards. And as long as you do it from the get-go, from the planning stage, they do not cost more. It does not cost extra to make a hallway in an apartment building 6 inches wider. There's a ton of other things you can do with this. I was speaking to a number of business owners during the COVID who were asking, what can they do in order to make it easier for people to manipulate where they're going in the store? You know, those arrows a lot of supermarkets have on the floor, and for some reason it's a black arrow on top of a charcoal covered base. In this type of Heather, could you find anything harder to see? They don't have to be 8 inches, make them 4 feet. You can take them off and it's over. The other thing I wanted to point out also at this particular point is in the customer service and the information and communication standards, it speaks to the obligation of the service provider to accommodate. And I think the AODA took a lot of that from the Ontario human rights language, but what it basically is meaning, and it states it right in there. I realize it may not be something we're used to doing, is advocating for ourselves, but if you need something and you're going into a business or here at the region or anywhere, tell them what you need. Tell them I require an accommodation in order to participate. Because I know if I get that call, the first thing I'm going to say is, thank you for calling. Would you like to get together so we can find out what is the best way for us to accommodate?
And I think that's a great piece of advice. And I think to your point too, one of the things I've been noticing in particular press conferences, because I think all of us are watching more press conferences these days when it comes to COVID announcements, that we're seeing the sign language interpreters,
yep,
those press conferences. So we're actually now able to see a little bit more in terms of the way we're serving the hard of hearing community. So I think, you know, I'm sure we've got a ways to go when it comes to the deadline of 2025, when it comes to the deaf and hard of hearing community, but at least we're making some strides.
Yes.
Let's move now to a more general panel discussion. So I'd like to start with Lee on this one. Lee, how do you think we're doing as a province in relation to making workplaces more inclusive for those with hearing loss as per the AODA in Ontario? And from an employer perspective, if we don't know where to start, what do we do? What should we do? Where should we look? How should we start?
Well, first off, I think businesses in the province are doing okay. And I'm going to say that exclusive of COVID. When we talk about access with COVID, we're really talking about coming in and out of a building being masked, which is in itself an issue. But really, if you don't know where to turn, if you're in the Greater Niagara region, talk to Steve. He's an expert. There's a huge resource. You can also access the CHHA. You can come and you can email us, you can speak with us, and we can give you some very quick tips and things to do when it comes to people who are hard of hearing. One of the most important things is to make sure that anytime you're communicating with someone and you have to hear, or your customers have to hear what's being said, is provide an option where it's written. And it can be as simple as a card. It can be closed captioning on closed circuit TV. Many professional businesses have those now. And they're really pretty good at having words flashing on the screen, but flashing isn't good. See, we got to slow things down so that you can read and comprehend. That's the same as anything with websites, having the little chat feature, and just having something that just lets people know that you can do this, that you can speak with people, is really important. Because as we ramp up to this, what's really going to happen is that there's going to be experiences that don't quite fit the mold, and like Steve said, don't quite hit the minimum requirements, or will take more than the minimum for business to be successful. And if you're a restaurant and your customers don't want to come in because it's too loud, then that's bad for business. And if there's no way that I can interact, and I can hear quite well, but if someone can't hear quite well, they're not going to come in. They're just not going to. They're going to shop online, which doesn't do well for a business, or they're going to go to somewhere where they are doing well, and they're going to tell their family. and they're going to do that. So whether it's ASL, the American Sign Language, that's great for big things, organizations, but having that ability, and for virtual meetings on whatever platform, every virtual platform out there allows for closed captioning. Some aren't easy, some are free, but they're all able to do that. And again, if you come across someone who is having a hard of hearing, ask the question. Most people have been living with hard of hearing for a long time, and they know, and they can provide the solution that's best for them. And that's really important when you're talking about being when you're working as an employee in an employer relationship, whether it's strobe lights, or if you're in a factory setting or a worker setting where you just have to carry around a notebook. There's simple things to do.
So as an employer then, there's resources and information that we can access through the CHHA and other organizations that would tell us sort of where to start to ensure that we are being more inclusive for our employees as well as perhaps our customers?
Yes, we certainly can.
Okay. So anybody out there who's interested, you should go to the CHHA website, which I don't know offhand, but I'm sure somebody will put it in the chat for me. So Noelle, I want to ask you about being an employee, and also just a member of the community. So as you navigate life, you're looking at everything through the lens of somebody who has had complete hearing loss. And so what do you think, how are we doing in terms of serving our deaf community? Both perhaps—
I mean, I've got to admit, every employer I've ever had has come to me and said, what can we do to make your life easier? Do you need the amplified phones? Do you need, the strobe lighting, fire alarm, just in case? Because, if my batteries die, I am completely deaf. So those kind of backup scenarios are quite good. But from an employer point of view, I can't say I've ever met an employer that wasn't willing to make an accommodation for me. If anything, I mean, the setting I was in prior, it would more have been my coworkers that weren't cognizant of my challenges, because I still did interviews in a newsroom. I would have to have everybody on speaker because, unfortunately, even with the implant, I don't like the sound quality on phones, but speaker works very well for me. So I would want to do an interview and I'd want to put it on speaker, and my colleagues would all be in the room and babbling away in the background, having their personal conversations, whatever. So but that wasn't because they were being rude. That was just the way the scenario went, because they weren't thinking. And a lot of times with people like me who do function quite well with a cochlear implant society, people forget that I do have my challenges still. I mean, it's improved, but I'm not perfect. So I think from an education point of view, I think staff needs to be more cognizant. Managers are quite good, but staff and colleagues not always remembering that this person's disabled, this person needs assistance, or we need to be a little more, respectful of what she needs to do.
And I guess that comes down to education and awareness, right? I mean, how—
and that's everywhere. Like, I mean, when Lee was saying in the opening that, when you make people repeat themselves and people get frustrated with you, a lot of people, like my whole life, I felt people thought I was dumb, because I would be, I'm sorry, I didn't quite hear you, or I would really pick up every third word and I would take a little longer to process what the sentence was. And they'd be looking at me like, oh, she's slow, she's not very bright, when that was absolutely not the case. And I mean, it was helpful in terms of having another person there that knew me well enough to say, hey, they said this and you misinterpreted this. But you don't always have those helpers with you. A lot of people, are afraid to tell people that I'm deaf, because especially from a woman point of view, some people can take advantage of that information, and not always in a nice way. But I mean, it really is, you just give somebody a piece of paper and a pen, or type it out on your phone to me. little things like that make such a huge difference.
I think that there's probably a fear out there among us too that, you know, and I don't know whether this is just human nature or whether it's a Canadian thing, but we're very afraid to offend somebody, right?
Yes.
So, I mean, handing somebody a piece of paper and a pen to say, can you write it down? Is that offensive? And am I dealing with somebody who might also be illiterate, right? And so how do you overcome that? And I think it's easy for us to forget that all of those things are possibilities when you're trying to communicate effectively with someone. And I think it's perhaps down to how do we approach the situation as to whether or not it's offensive or not. And I think that, and I mean, you can answer this for me, but I think that if I handed you a piece of paper and a pen, would you be offended by that if we were having difficulty communicating? Is that something that is acceptable to do?
To me, no. I mean, it takes a lot to offend me. It really does. I think it's just because of how I grew up too. I mean, from 18 on, I had to learn coping skills and survival skills because I didn't always have somebody to help me. And I mean, I think in terms of technology advancements, I mean, the way society is now, I don't have to talk to anybody. I can do everything. Online shopping has been amazing for people like me. The plexiglass barriers in restaurants, that actually makes the sound a lot tighter, and I hear better now in some restaurants where the plexiglass is up. However, in a situation like when you go to Zayre's and everybody's in their mask, then they're behind plexiglass. It's a disaster. I mean, I think it's a disaster for a lot of people with perfect hearing. For people like me, it's even worse. But like when you go to the hospital, they're already behind glass. They've always been behind glass. But what do they have? They have a microphone. And that little thing makes such a difference because you can hear the elevated sound. I mean, is it realistic to see that they would put them in supermarkets? I don't think so. But it's little things like that that can really make a difference for people in a customer service environment.
Yeah, I'm glad you brought that up because that actually leads me to my next question. And I think that, you know, depending on how long we go through this, we might start seeing more microphones and plexiglass. We don't really know, right? So let's talk a little bit about the pandemic and communicating effectively. So Noelle, you've already raised the issue of plexiglass as well as face masks. So face masks are going to have quite an impact in terms of our ability, even for hearing people, to be able to communicate effectively. So I'm wondering, and Lee, I'll start with you on this one. Do you think that the pandemic has increased our awareness and sensitivity around hearing loss? Lee, are you there?
He's muted.
Oh.
Yeah, sorry, my screen was jumping around. It wouldn't let me unmute. There, now I'm unmuted, I hope. Yeah, the pandemic really has put that out there. I think the most visual way of doing that is with the ASL interpreters on news conferences that we see on a regular basis. Even though we don't know what that person is saying necessarily, but you know it's there and it's there for a reason. But when it comes to the practical, again, the everyday aspect, the masks are probably one of the most important things that we've had to keep our health, but they're also some of the most isolating. Now, we have these at the CHHA. They're a clear mask, and they work really well. I've worn mine a few times going out in places where obviously no one's seen them before, and people, they look at you. And I think that's the other thing, is that looking at someone face to face, which we all do on Zoom calls, that helps with people who are hard of hearing to get used to lip reading. We offer lip reading services at the CHHA too, like training, but it's that ability to look someone in the eye and speak to them that's important. And the access masks, the masks that you can see, really do help that. But the pandemic has made it really easy for people of any disability or any type of way who doesn't want to communicate and isolate themselves a little more. And I think that we don't realize that that is really, really hard for people who can't hear and interact. It makes it easier some ways. You know, you were saying that it's easier sometimes with the panels can focus your sound, or just to do shopping online, but that's not always the best way to communicate. Communicate has to be two ways, and you know, having that come out is really, really important. And I think there's one thing, if we're allowed to think about it, is if someone is on a Zoom call and they start to freeze, and you can't read their lips properly, even if you're completely able to hear what they're saying, it throws you off. And that's something that people who are hard of hearing deal with every single day. And so if we want to make it more aware, then we can. But I think we have to prompt ourselves. And this webinar, this type of thing, is exactly what needs to happen, so that, you know, just it's a reminder that, you know, we can take advantage of a situation and we can use it to, okay, I remember that, and then move on.
I think that's a really good point, that when we experience that freezing, right, and we can't see, that can really, it puts it in a different perspective, right? That's what people that are experiencing hearing loss are experiencing. And I don't think any of us probably realize how much we depend on seeing the person, and in our just regular communication, and how that has an impact. Steve, I want to ask you, when it comes to COVID, how are workplaces adapting when it comes to communicating? And does the AODA go far enough to ensure that people that are hard of hearing are able to fully participate in their life? Again, in sort of through the lens of COVID and the difficulties that we have communicating through masks and plexiglass, et cetera, et cetera.
Okay, thank you. My first comment about COVID is wearing those masks is an absolutely phenomenal opportunity to educate others, as long as we acknowledge it is. I haven't seen one, but I was talking to someone yesterday about that, and it would make sense if somebody made masks that on the outside of it, it said something like, could you imagine having to wear this every day? Something to get people thinking that this isn't what they're used to, and it's not what a lot of others are used to either. And it comes with a set of hurdles and obstacles that we have to get through. Just an idea. I've seen everything on them, from sports teams to the refreshment ads and everything else. Why can't we put up something that makes people think where you want them to think? Mm-hmm. My second point is the majority of businesses and public sector places have websites. Under the customer service standard, it states that you have to have a method for patrons or people visiting your business to provide feedback. What we do here at Niagara, we have it on our website, as along with the other ABCs who are covered under our compliance. And instead of saying, oh, it was lovely or whatever, that's a great opportunity for somebody to say, it was this and this. The next time I visit, it would be better if I could. So what you're doing is you're offering the person to provide you with what they feel is an accommodation that's going to keep that person shopping at your business. Because for people who are aware of it, and they're aware that it doesn't have to cost you millions of dollars, accessibility is good for business. We have a lot of seniors who have money who want to go out and spend it. And I use the example, if I couldn't get my father into a business, I'm not leaving him out on the street on a day like today while I go looking for golf balls. That kind of thing. So it makes sense that anything we can use, whether it's intended to be used as a way of raising awareness or a way of for somebody to be more specific on what type of an accommodation they need. Do they need larger signs? Do they need more things in larger font? Do they need those arrows in the floor to be orange and yellow? Do they need the snowplow to stop putting snow in the accessible spaces? Whatever it is, because we don't always notice it. So if you want to bring that to my attention or to someone's attention, I think if our heart's in the right place, you're certainly not going to be seen as offensive.
And I think that that's a good point, and that the feedback that we provide in terms of customer service needs to be specific and it needs to be clear. And I think that from a business perspective, as a business owner, like, do I know if I'm losing customers as a result of, there's too much ambient noise. There's too many people. I can't hear properly to the person that I'm with. So instead of knowing that you're losing customers as a result of, your price isn't right or whatever it is, there's not enough parking. Now we're losing customers as a result of not being accessible to the hard of hearing and deaf community.
Yeah.
So we need to be a little bit more aware of that. I'd like to move a little bit now to some technology, because clearly there's been some great strides when it comes to technology and the various ways we can assist people who have hearing loss. So tell us about, Lee, I'll start with you on this. Tell us about some things that we might not be aware of. And here's the word I was looking for earlier, like hearing loops, which is the induction loop system. And are there other technologies that are available for businesses to put in place, both from an employee perspective? And let's remember that we want to attract and retain our employees as well. And we need to be looking through that equity, diversity, and inclusivity lens and making sure that our workspaces are inclusive. But are there other things too that we can do, both from attracting employees as well as customers?
Yeah, there's a few things, and not everything has to do with technology. I mean, providing a benefit program that allows for hearing aid and cochlear implant purchases. The benefit program can help. That's really, really important because it does, allow for some expensive devices, the personal devices, to be used, and then that benefits your employee, which in turn benefits the business. Now, the hearing loop technology is something that is quite simple in the ability to install it and put it in. They can be put under a counter. They're just as easy to install, as far as I understand, as a microphone would be at, like they have at banks and, customer service, kiosks. You can put them right there. They can be one-on-one, or they can be in grand places, like conference centers or large areas where you've got gatherings of people. And what they do is it's a type of system that allows the hearing aid and the cochlear implant to pick up just what is being said in front of the microphone, and it disables all of the sound. It reduces the background noise to makes everything clearer. And so the loop cable, it acts like an antenna that really helps the person who has a cochlear implant or a hearing aid hear better. Their conference centers, performing arts centers have this type of technology, and they can easily be installed anywhere where there's electricity. And they come with a little sign that you put up there, and it's the universal, the ear with a with a stripe, and it's blue, so it fits in, and customers can see that that's happening, and being able to advertise that is also really important. It blends in with the surroundings, but it also allows you to do that, and those are really good technologies. The cell phone is a simple thing, or a tablet that people can use as well is good. And for really small businesses, where the customer service, you may not have that on a regular basis, again, just a simple pad and paper. But for someone who wants to really be there all the time and not have to do a unique situation, the hearing loops are really good.
Yeah, you mentioned tablets and mobile devices, something that we don't necessarily think of in terms of technology for the hard of hearing community, right? But they have really helped. And Noelle was talking earlier too about online shopping, and the better that gets. And I think that there's a lot of businesses out there that have been able to adapt new technology, improve their websites, improve their online stores, and that sort of thing throughout this pandemic, that it's probably helped this community without it necessarily being the reason that these sorts of technologies were adapted and started to be used more widely. I just also want to mention right now, for those of you who are with us, to take a look at the chat. There's some really interesting comments being made. I haven't seen a lot of questions yet that haven't already been answered by other people that are attending. So it's great that this is happening. So keep that up. So another question I want to ask is, and Noelle, I'll go to you on this one, because I think you've touched on it already, and Steve has as well, but I think you all have actually, how does making our spaces more inclusive for people with hearing loss benefit the rest of the community?
Well, I think Lee mentioned it right at the beginning when he said 4 million Canadians have hearing loss. And I mean, we live in Niagara, where we have the aging population, and the natural course of your life, everyone's going to experience hearing loss at some point in time. I mean, especially, I look at even the ramifications of the pandemic on the education of the students right now. Everybody's putting earphones in and they're on electronics learning. They're putting headphones on way more than we all did. What's the ramification going to be of that down the road? So, I mean, anytime you do anything to accommodate hearing loss, I think you're going to benefit the entire society eventually. I look forward to the day when everyone else has hearing like I do, so I can say I'm electronically better than the rest of you, because of my hearing loss. When I'm 90, it's going to be pretty good hearing if it stays the way it is. But I mean, even just making like little things in your business environments, like where you have windows, put a cover on them, or put a mat on the floor, or carpeting on the floor. Those things help absorb sound, like the sounds that bother people that have hearing aids or implants, like the clicking of the high heel shoes on the floor. Sometimes those things, they seem small to other people because you've been tuned your whole life not to hear them. But people that have implants and hearing aids, those types of things could be new to us, and we don't always hear them all the time, and it tends to dominate your hearing when you're in that environment, and you forget what's going on around you and that someone's talking to you. So I mean, like, just little things like that make a big difference for everybody, whether you have a hearing aid or not, because it helps absorb the sound that is annoying.
Right. So we've only got a few minutes left, and I'm not seeing, there was one question that we had earlier that we can maybe try to get to, but I'd like to ask one more, and I'll start with Steve on this one, just quickly. For businesses and organizations that are, and people that are out there right now watching this Zoom call, what are we calling it? Town hall. If there was one action we could take right now to make our business or organization more inclusive, what would it be? Steve, what do you say about that? For the hearing, people with hearing loss, What would be the one action that we could take right now to make it more inclusive for people with hearing loss?
Make it as easy for people with hearing loss to communicate with us as possible, whether that means website, whether that means signage, whatever that means. Make it as easy for people to be heard, because as soon as they're being heard, they become an asset. They become an asset to your business, to your family life, to all those things that we were maybe ignoring them for, or they were being ignored unintentionally. So reach out, and if a question feels awkward to you, get over it. If it's done with the proper intention, it will be received with the proper reaction.
I love that. That's asset. Lee, what do you say about that? One action that we could take right now to be more inclusive.
I think I agree with Steve, is make sure there are alternative forms of signage, speaking to people directly. Do the simplest things really well. Look people in the eye, and when you speak to them, speak clearly, speak slowly. Make an effort to know that you are trying to communicate with someone, and provide the alternate forms of communication, such as good signage, clear directions, and written availability where you can. It's really not that difficult. And again, ask if you can help. And if you do it in a kind way and people are in your store, they know you are trying to help. And so that's really, really important.
That can never be wrong. Thanks for that. And Noelle, what would you say? One thing somebody could do right now.
Just slow down and enunciate. Everyone needs to slow down their speech and enunciate. Because even with the masks on, if you slow that speed down and you're speaking clearly, we'll catch it.
Great advice. Thank you. So we did have a question from Martin at the BDC. What software should one look at to facilitate communication with persons having a need? I'm not sure. Lee, can you take that one?
When he said what software?
What software should one look at to facilitate communication with persons having a need?
It really depends on the context. If you're talking about virtual conferencing, which seems to be what we're doing right now, Zoom does provide automatic captioning if you have a paid subscription. Microsoft Teams, Cisco WebEx, Google Meets, those are for the top ones that provide captioning on an easy to use and access basis. And otherwise, there's some free and there's other paid ones. This is something that CHHA is going to be putting a report out in short order. We need to get some more lived experience from people who are hard of hearing with closed captioning. But there are several organizations that also provide closed captioning that you can purchase a service for. And for large organizations or big events, that's a good software. Otherwise, I invite the person who asked the question to email us with very specific requests on what they need to do to communicate and who they're communicating with.
That's great. And that brings me to the conclusion of our panel discussion. And I just want to reiterate for everyone that if you had a question that didn't get answered today, we're going to be taking a look through the chat, and we're going to be following up with everyone to make sure that all of your questions are answered. So I'd like to just say thank you to all of our panelists. I think it's been a really great conversation to have, and I think it's been a really necessary conversation to have. I think that we often forget about the hard of hearing and deaf community that is around us, unless we ourselves are experiencing it, or people that are around us are experiencing it. So I really appreciate the time and your insights and everything that you gave us today to our panelists, Lee, Noelle, and Steve. Thank you so very much for being here. And if there's anybody out there wondering if there's accommodations that they have to be be made in your place of business. Again, I'm going to refer you to the AODA website. There's some resources there. So that's aoda.ca. So thanks again to our panelists, Lee, Noelle, and Steve. Really appreciate your insights and your time today. Thank you very much to our sponsor, Hearing Loops Canada. Thanks to our host, the Greater Niagara Chamber of Commerce, and to each and every one of you out there. Thank you so much for zooming in to listen to us today or watch us on closed captioning. I want you all to have a great day and stay safe. Thank you so much.
Thank you.